My name is Albert Masua from Kenya Society for the Blind. I'm the head of eye care and health promotion. Through the week, we've been able to start a school eye health program within Siaya County between 3 schools. We started at St. Albert's Mero Secondary School, which is a mixed school. And through that, we were able to identify learners who had eyesight problems. We were able to give them interventions in terms of medications and also spectacles correction. We also identified learners who needed further interventions through surgical interventions, and we were able to refer them for that. The last 2 days, we've been able to screen the Rangala Boys High School, and through that, we were able to reach to about 1,299 learners. Through that, we were able also, again, to intervene in terms of medications and also give them spectacles. The boys are happy about it. Today, we are targeting about 600 learners from the Rangala Primary School, Boys School, and be able to give back to them in terms of gift of sight. In terms of this CSR partnership between Kenya Society for the Blind and REREC, we are able to offer services to people who cannot afford them, number one. Number two, people who are not aware of these services, and also be able to reach the learners. Being at a tender age, correcting their sight at this age is very critical.
My name is Calvin Omondi. I'm the County Coordinator of Eye Care Services in Siaya County. And we are very happy for this initiative of school screening that has been brought by the REREC and the Kenya Society for Blind. As you know that eye care services all over the whole country, they are deficient. And most of the eye diseases are either diseases are either treatable or can be stopped. And in Siaya County, around 57% of the population have visual disability. And the visual disability, the main cause of visual disability is the refractive errors. And the only way that you can sort the refractive errors early is by doing school screening, because most screenings are done in children who are school-going age. So when it's done early, then you can always catch the refractive errors early and reduce them. And as we know, as a government, we may not be in a position to support all the health initiatives, leave alone the school screening, because the health is huge. And as a government alone, we may not support health in totality. And for us to reduce the blindness, we need partners like the Kenya Society for the Blind, the REREC, to help us in this initiative so that we can reduce the blindness within Siaya County.
My name is Janet Alice Adol, and I'm from Ambira Ward. I come from here at Rangala Holy Trinity Catholic for eye medical checkup, and I heard it being announced at the radio that there was a service which was going to be held here, and I came. I like how they have handled me, because I came with an eye problem, and I'm fully satisfied, and I've liked how they treat me. I've get my medication, and I hope I'll be fine.
My name is Braville Job, a student from Rangala Boys High School. So I want to start by thanking the administration block for bringing us a screening at school, eye screening. For me, I have been suffering from eye allergy, and today I went for the screening. I have been tested and I have received my medication. For this, I am thanking the organizations involved, such as REREC and KSB. Also thanking our senior principal in absentia for this. May God bless you.
One of the major causes of students' truancy has been eye problems, because when the medical scheme that was providing for the students was withdrawn, it became very difficult for our students to access some of the medical facilities. But we are very happy that this free eye clinic has come in good time. The organizations have been here now for some time. Today they're in our school, and tomorrow, today is a Wednesday, tomorrow is a Thursday, and they'll also provide their services to members of the community who are around us here. We really want to thank them for this initiative, because good eyes means good education, and good education, of course, will give us better leaders tomorrow. Thank you so much for your support, Rebecca. Thank you so much, KSB. We wish that we'll continue partnering in this, and also thank you for remembering our school.
My name is Jonathan Butu, manager alternative energy at EREC. I'm an engineer by profession. I also double up as a chairman, CSR, corporate social responsibility for the corporation. EREC has two major mandates, rural electrification and renewable energy development. I focus more on renewable energy because that is an additional mandate which came on board after the enactment of the Energy Act in 2019. The iCamp activity is one of the most exciting activities. As a chairman of a CSR, I am always excited to participate in this activity because of the transformation I've seen it and the benefit I've seen it in the programs I've done before. This is ours for the iCamp activity. In the process we have been, the impact has been significant. And specifically, as a CSR program, we have 5 pillars. One of them being health and education. And I find this iCamp as a nexus, is where health and education converge, because you realize that eyesight is very critical for the education process of a kid. If the child is not able to see clearly, then he cannot follow the teacher clearly in his education program, he cannot revise properly. Definitely that will affect his performance. Ideally, actually, this screening process, I would suggest that if it can be enhanced, then it's done early. My feeling is if a child is in a school for PP1, PP2, 2 years, 3 years with an eye challenge, that is already too late because then it means that he has missed his early years in following up education. If the resources in this program can be enhanced and we are able to do this even across the country at the early stage, at the entry point of entering the school, then the interventions are made early. Definitely then the life of that child who is not seen at that point, it is changed that early. So generally, I think this is a program we have seen change the education of many kids, performance of many kids. Then we expect this, of course, to be enhanced as we move forward.
My name is Beatrice Njuguna. I'm the General Manager in charge of Information, Education and Communication at REREC. We are here in Siaya County to undertake one of our CSR projects that we always plan for every financial year. And this time we planned it to be according to our schedules. It is in Siaya County. And that's why we came here to implement the medical camp. This is an initiative we usually do to give back to our communities that we electrify in the rural areas. REREC undertakes the CSR program in various counties. We have done it in Kitui. We have done the medical camp in Kwale. We have done it in Kirinyaga. We have also done it in Meru, and now we're in Siaya. And we shall implement this project and this program in all the counties that we implement our projects according to our schedule. The next financial year will be in another county. In this program that we have done in Siaya, it has been very impactful for the community, where we've been able to medically interact with the students, the various schools around the community. We've interacted with parents, with teachers, where we've been able to medically treat over 2,000 participants who have showed up for this project. In all areas we have done the medical camp, we have seen a lot of responsiveness from the community, because in the country, getting eye treatment to the people is very expensive, and it's not easily accessible. So through this program, one of the pillars of the CSR program for the corporation is health, and we opted for the medical camps in all the constituencies in the country, and therefore we have seen a lot of impact in this project.
As a partnership between REREC and Kenya Society for the Blind, we are happy to be able to offer this, coming to achieve what the WHO has given us a mandate to be able to target an upscale of about 30% by the year 2030, considering that we're only 2 years or 3 years away from this. So such activities are able to enhance eye care services, which are very impactful, and also give the learners what we call the quality of life, even in their academic years. So in future, we're hopeful that we can be able to roll out such activities over and beyond Siaya County, and also look at the other aspects that we've been also partnering with REREC in terms of offering cataract surgeries to the community. So for us, as Kenya Society for the Blind, we are happy and look forward to more engagements to be able to offer such kind of activities and giving back the gift of sight to those who actually need them.